everyone, welcome to our comprehensive guide to understanding Humana insurance plans. Whether you are a newcomer navigating the world of health insurance or a seasoned veteran looking to explore your option, then let me tell you that you are at the right place. This is our second video tutorial. In our first video tutorial, we had discussed in detail about history and the background of Humana Insurance, its mission, values, and also Medicare basics, guys. So if you did watch the video, I would suggest you to watch that video as well. So guys, Humana offers a wide range of plans which is designed to meet the diverse needs of individual and family, from Medicare Advantage to employer-sponsored plan and beyond. There is a Humana option for almost everyone, guys. So in this video tutorial, we will walk you through the key aspects of Humana insurance plans, including coverage options, costs, and benefits. So by the end of this video tutorial, you will have a solid understanding of what Humana has to offer and how to choose the right plan you need, guys. So if you are ready to learn everything you need to know about Humana insurance plans, then let's get started.
So we are on Humana official website, guys. So in our first video tutorial, part 1, we have discussed about Medicare basics and we have covered all these topics. What is Medicare eligibility, criteria for Medicare, then how to sign up for Medicare, how much does Medicare cost, and what does Medicare cover, right? So now in today's video tutorial, we are going to understand the different types of Medicare plans. Now, what is Medicare Part C? Compare Medicare Advantage plans, original Medicare versus Medicare Advantage, what is Medicare Part D, and what is Medicare Supplement. All right, so let's click on what is Medicare Part C. All right, so we will wait. All right, so we are on this page right now. Now let's understand what is Medicare Part C. Now, Medicare Advantage, also known as Medicare Part C, are private insurance plans offered by Medicare approved companies. Now, Medicare Advantage plans provide most of Part A hospital insurance and Part B medical insurance coverage, and typically offer extra benefits such as vision, hearing, and dental care. Some Part C plans also include Medicare Part D prescription drugs coverage, guys. Now let's scroll down. Now here you can see the table of contents. What does Medicare Advantage cover? Original Medicare versus Medicare Advantage, type of Medicare Advantage plans, frequently asked questions, do I need a Medicare Advantage plan? So now we will understand this one by one. All right. So the first point, what does Medicare Advantage cover? Right now, Medicare Advantage plan cover all the inpatient and outpatient services that Medicare Part A and Part B cover, except clinical trials and hospice services. If you enroll in a Medicare Advantage plan, original Medicare will still help cover the cost of hospice care, some new Medicare benefits, and some cost of clinical research studies, guys. Now here, some of the medically necessary services covered by Medicare Advantage plans and original Medicare includes primary care and specialist doctor visits, then laboratory tests, then x-rays, emergency ambulatory services, durable medical equipment, preventive tests and vaccines, physical therapy, guys. Now, Medicare Advantage plan can also include prescription drug coverage. To get the sum coverage with original Medicare, you would have to buy a separate prescription drug plan and pay a separate premium, guys. Okay, now let's see extra benefits which are included with a Medicare Advantage plans. Right? Since Medicare Advantage plans are offered by private companies, they can be customized with extra benefits. Some benefits may provide coverage for routine dental care, dental exams, x-rays, teeth cleanings. Routine vision care, which includes eye exams, eyeglasses, and contacts. Then routine hearing care, which includes hearing test, hearing aid, then fitness programs, gym membership, and transportation to doctor visit, over-the-counter drugs. Now, these plans can also be customized to treat specific conditions and disease. Now, what are the difference between Medicare Advantage and original Medicare, guys? The main difference is Medicare Advantage plans are offered by private companies and original Medicare is administered by the federal government. Now here we will see side-by-side comparison of original Medicare and Medicare Advantage. All right. Here is Health Maintenance Organization, which is also called as HMO plans, guys. Remember, so whenever I will say HMO, then you should, remember that that is Health Maintenance Organization plans. All right. Now here, details. What are the details? HMO plans may offer lower premiums than other plans. You must usually stay within your plan's networks for care and services. Now let's understand in detail about Maintenance Organization plan, guys. So let's click on HMOs, guys, here. So we will get the detailed information about Health Maintenance Organization plans. Now here, first basic question, what is an HMO? Now, HMO stands for Health Maintenance Organization, which I already informed you, which I already said. HMOs have their own network of doctors, hospitals, and other healthcare providers who have agreed to accept payment at a certain level for any services they provide. This allows the HMO to keep costs in check for its members. There are two features that set HMO plans apart from other types of healthcare plans: cost and choice. First, lower cost. First, lower cost. Because of the agreed upon payment level, an HMO usually offers lower monthly premiums than other types of insurance plans. They also tend to have lower copays and co-insurance, which helps make them more affordable. HMOs are an affordable options for people who don't usually need anything more than basic medical care like annual checkups and immunization. All right. However, even though costs are generally lower with a HMO plans, they don't cover any out of network care except in a true emergency. All right. Now, choice of providers. Now, with HMO plans, you must choose a primary care physician from a network of local healthcare providers when you join. This is the doctor you will see whenever you need medical care. Your PCP will be the provider with the best overall pictures of your health and will be the one to coordinate any additional care you might need. All right, let's scroll. If you were to need the care of a specialist, you would first see PCP, then, if needed, he or she would provide a referral to a specialist within the HMO networks. For example, if you suffer from back pain, you would first be examined by your PCP. If your doctor determined you needed the services of a specialist, he or she would refer you to an in network specialist for care. Since the specialist is in your network, those services would be covered by your insurance after making any copays or co-insurance and meeting your deductible. Now, if you would have Now, I'm so sorry. Now, if you would like to keep your current doctor and he or she does not belong to an HMO network, you might want to consider as a preferred provider organization plan, which is also called as PPO plans. Now, is an HMO plan right for me? That is the question. If you have this question, then let's understand this. There are several factors to take into account when choosing whether an HMO plan is the right option for you and your family. Some key things to consider are cost of monthly premiums, out of pocket cost, then using a PCP versus choosing your own healthcare providers, the current health of people you want to cover. All right. So, if you are someone who doesn't need a lot of specialist care or don't mind having your care coordinated, I'm so sorry, or don't mind having your care coordinated through a PCP, you can save money with an HMO plan, guys. I'm so sorry. Well, eligible for Medicare. Now, here is the option. You can take a look at that. You can click and find the details there, right? Still not sure an HMO is the way to go? You can get more information about the difference between HMO plans and PPO from a HMO versus PPO comparison chart, right? So you will find the details there. All right. So this was the explanation. Now let's go behind. All right. So now we know what is an HMO plan or what is HMO called and what are the advantages, benefits, and everything. All right. Now, the second plan is Preferred Provider Organization, which is also called as PPO plans, right? Let's have a quick look and understand PPO in details, right? Let's click here on this PPOs, all right? Okay. Now, what is a PPO? That is the question. PPO stands for Preferred Provider Organization. Just like an HMO or Health Maintenance Organization, a PPO plan offers a network of healthcare providers you can use for medical care. Now, these providers have agreed to provide care to the plan members at a certain rate, but there are some differences. Let's go over the key things to consider when deciding if a PPO plan is right for you. All right, more flexibility. Unlike an HMO, a PPO offers you the freedom to receive care from any provider in or out of your network. This means you can see any doctor or specialist or use any hospital, guys. Now, in addition, PPO plans do not require you to choose a primary care physician and do not require referrals. For example, if you already have a doctor you like, you can continue receiving care from that provider. Okay. If you need to see a specialist, you do not have to first consult with PCP. No referrals are required for any doctor, specialist, or hospital, guys. Now, another bonus, if you find yourself in need of medical care when you are away from home, you can see any healthcare provider you choose. Okay, now higher costs. A PPO health insurance plans provides more choice when it comes to your healthcare, but there will also be higher out-of-pocket costs associated with these plans. Your monthly premiums will be higher and your co-pays for office visit will also cost more. Plus, There is also an annual deductible that must be met. To help reduce costs, remember that using in-network providers, doctors, and other healthcare professionals who are a part of your PPO network will save your money. Now, getting a plan. If you are eligible to enroll in Medicare, there are Medicare Advantage PPO plans available. Now, here is the link. All right. Now, is PPO right for you? That is a question, you must be thinking. Now, a PPO is generally good option if you want more control over your choices and don't mind paying more for that ability. It would be especially helpful if you travel a lot, since you would not need to see a primary care physician. The key to finding the right plan for you is to strike a balance between the coverage you want and the premium you can afford. Now, for more help deciding if a PPO or an HMO is right for you, then you have to see a HMO versus PPO comparison chart, guys. All right. Now, if you would like some help figuring out how to manage your healthcare costs, we can help. All right. So definitely you can just get in contact with the customer support of Humana. All right. Well, now here we'll scroll down. All right. So these were the understanding of PPO plan, guys. All right. Now let's go back. All right, all right. So now we got to know preferred provider organization, and we also know health maintenance organization, and the short form which is called as HMO plans, and preferred provide organization plans are also called as PPO plans. So you should remember this. In this video, sometimes I will use short forms, so you should understand that I'm talking about this. All right. Okay, then. Now let's understand private fee for services plans. Now, which is also called as PFFS plans. Let's understand PFFS plan in detail. All right. So I've clicked on this option. Now, Humana Medicare Advantage Private Fee for Service Plan. This is the full form. All right. So every time I will not use the full form, I will use the short form. Remember. So it is Humana Medicare Advantage Private Fee for Service Plans, which is called as PFFS. All right. Now, learn more about the costs and coverage of our Medicare Advantage PFFS plans, or enter your zip code to see the Humana PFFS plans available in your area. So you simply have to put your zip code, click on view all PFFS plans, and you will get the details. All right. Now, how a private fee for service plan works. Enjoy the added flexibility of a private fee for services plans, right? You can see almost any Medicare approved provider you choose as long as they accept the Humana Medicare Advantage PFF terms and conditions of payment, guys. Now, no referrals are needed with a PFFS plans, but you will need to show your Humana member ID card each time you go to a healthcare provider to be sure they still accept the terms of your plans. Most PFFS plans offer prescription drug coverage and all included emergency coverage anywhere in or out of United States like all Medicare Advantage plans. PFFS plans include all the benefit of Medicare Part A and B. They also offer the added security of an annual maximum out-of-pocket cost limit. Once you have reached that limit, you will pay nothing for covered services until the end of your plan year, guys. All right. So we have covered this as well, and now you know Humana Medicare Advantage private fee for services plan, which is called as PFFS plans, guys. All right. So let's go back on our main page. All right. I'm so sorry. That is not a main page. Okay. Perfect. So now we will jump on special need plans, which is also called as SNP. Remember that. Let's understand SNP in details. Let's click on this option and let's wait. All right. Now, Medicare Advantage special needs plans. Do you have a chronic health condition? That is the question. Are you eligible for Medicare and Medicaid? A special needs plan may be right for you. All right. How a special needs plan work, guys? Let's understand that. A special need plans, which is called as SNP, remember the short form, is a type of Medicare Advantage plan that combines all the benefit of original Medicare, which is Part A and Part B, with prescription drug coverage Part D. SNP plans are only available for people who have an additional qualifying condition or are eligible for both Medicare and Medicaid. Now, type of special needs plans. Now, chronic condition special need plan offers special care for people with diabetes, cardiovascular disorder, chronic heart failure, chronic lung disorders, or other qualifying conditions. Dual eligible special needs plan are for people who have both Medicare and Medicaid with a DSNP. All right. All your Medicare and Medicaid benefits are combined into one easy to manage plan, guys. Now, all right. So now we got to know about the Medicare Advantage special need plans, guys. Okay, now let's go back on the page again. So we are trying to understand all plans step by step, one by one, guys. Okay, now medical saving account MSA plan, right? MSA combines a high deductible plan with a designated saving account. These plans do not include prescription drug coverage, guys. Now, HMO, point of service, okay, and the short form is HMO POS. These hybrid HMOs let you go outside the network for treatment but may have a higher cost. They can be separated deductibles for in-network and out-of-network cost, guys. Okay, now let's see the frequently asked questions. All right, how much do Medicare Advantage plan cost? This is the question most of the people must have, and even you must be thinking about this question. So if you have this question, let's get the answer to this question. The cost of Medicare Advantage plan depend on the plan and the company. The projected average premium for a Medicare Advantage plan in 2024 is $18.50 per month. But there are other costs to consider, such as copays and deductible. Now, how do I enroll in a Medicare Advantage plans? First change to sign up for Medicare Advantage is during your Medicare initial enrollment period, which is called as IEP. The IEP for Medicare starts 3 months before the month you turn 65 and ends 3 months after. Now, if you have original Medicare and want to enroll in Medicare Advantage for the first time, you can choose a Medicare Advantage plan during Medicare's annual enrollment period, which is called as AEP. Medicare's AEP runs from October 15th to December 7th. Now, if you are already enroll in Medicare Advantage, you can switch plans during Medicare Advantage open enrollment period, which is also called as OEP. The Medicare Advantage OEP runs from January 1st to March 31st, guys, or the annual enrollment period for Medicare. All right. Now, do I need a Medicare Advantage plan? That is the question. If you have this question, then let's get answer to this question. Everyone has different health needs. If you have a chronic condition or need routine medical care, the comprehensive coverage of a Medicare Advantage could make sense. Set aside time to research MA plans that fit your needs, guys. Make a list and choose the first that benefit you the most. All right. Compare Medicare Advantage plans, guys. So there might be many topics which we have already covered, but I will repeat it again. So don't worry, that is a revision for us. All right. So it will be a kind of revision. So don't worry. So the benefit of Medicare Advantage plans can make them a great alternative to original Medicare. However, it is important to understand the differences of each plan before making a decision. To help you choose what's best for your needs, let's take a look at the types of Medicare Advantage plans and how they compare. What are Medicare Advantage plans? We have already discussed this, but still, let's do the revision. Medicare Advantage plans, known as Part C, are sometimes referred to as all-in-one packages for original Medicare services. They cover Part A and Part B, and most includes Part D, prescription drugs as well. Some Medicare Advantage plans also offers benefits that aren't available with original Medicare, such as routine vision, hearing, and dental care. To help you choose what's best for your needs, let's take a look at the types of Medicare Advantage plans and how they compare. All right. Now, comparing the different type of Medicare Advantage plans. The most common Medicare Advantage plans are Health Maintenance Organization plans, which are called as HMO plans. This is what we have already discussed, and we know what is Health Maintenance Organization, but still, let's do a revision. Now, HMO plans may sometimes offer lower premiums than other plans, but you must usually stay within your plan's network for care and services. Now, preferred provider organization, which is called as PPO plans. Now, PPO plans may allow you to go out of network for care, but you will usually pay less if you stay within the plan's network. Then private fee for services plans, which are called as PFFS plans. Now, PFFS plans are offered through private insurance companies. You will pay healthcare providers directly for services based on an amount that your plan determines. Then there is a special needs plan, which is called as S&P plans, are tailored to meet the specific needs of members within the plan. Now let's do the comparison. Compare common Medicare Advantage plans side by side. Here is the chart, guys. Okay, where you can see plan features, HMO plans, PPO, PFFS, SNP. All right, then coverage for prescription drugs Part D, referral requirements for specialist care, contracted network of doctors and hospitals, ability to use any doctors or hospitals outside of network. You have this chart, guys. You can just go through the chart, go on the official website. This is the official website. If you come here, you can see this chart, all right, and you can do your studies. All right, let me go ahead and explain what to consider to make a Medicare Advantage plans. All right, To help you compare Medicare Advantage plans and see their differences, here are some important features to consider. Coverage for prescription drugs Part D. Most Medicare Advantage plans offer prescription drugs coverage, and all S&P plans must cover prescription drugs, guys. Referral requirements for specialist care. Most HMO plans require you to get a referral from your primary care physician for specialist care, with PPO plans typically do not. Some PFFS plans and SNP plans require a referral. Now, contracted network of doctors and hospitals. All Medicare Advantage plans have a contracted network of doctors and hospitals that work in coordination to services your individual healthcare needs, guys. Ability to use doctors or hospitals outside of networks. HMO plans generally require you to use doctors or hospitals in your network. PPO plans allow you to go outside of your network, but the cost may increase. PFFS plans let you go outside of your network if the doctor or hospital accepts the payment terms and agrees to treat you. And SNP plans generally require you to stay in your network. Now, star ratings. What is that? Each year, the Centers of Medicare and Medicaid Services (CMS) releases the Medicare Advantage and Medicare Part D star rating. These ratings go up to 5 and measures the quality of Part C and Part D plans based on up to 38 performance measures, including customer services, care coordination, and availability of certain preventive care screening, guys. Now, here are the frequently asked questions, and we have already gone through these questions. Let's scroll down. Find the best Medicare Advantage plan for you. Now, everyone has different health needs. Now, be sure to look up your plan's network, cost, and its list of covered drug before making your decision. By taking the time to research and compare Medicare Advantage plans, you can find the one that benefits you the most. S&P plans can be any type of MA plan such as an HMO or PPO. All right. So I'm sure that we have the complete understanding of this comparison Medicare Advantage plan, right? Let's go back. All right, let's go back. Superb. So we are on this page right now. Okay. So now we know what is Medicare Part C. We have compared Medicare Advantage plan. Now let's do original Medicare versus Medicare Advantage, a kind of comparison. Let's click here and see the options. All right. So here, Medicare Advantage versus original Medicare. Which option should I choose? All right. Now, original Medicare Part A, hospital insurance, and Part B, medical insurance, pays for many, but not all, healthcare services and supplies. If you want extra coverage for routine medical care and even prescription drugs, Medicare Part C, also called Medicare Advantage, could be the answer. Now let's explore both type of coverage so you can choose the best Medicare plan for you. Now, what's the difference between original Medicare and Medicare Advantage? The main difference is original Medicare is administered by the federal government and Medicare Advantage plans are offered by private companies. Here is a deeper look into what makes them unique. Now, what is original Medicare, guys? Now, Medicare is our country's federal health insurance program for people aged 65 and older. as well as some younger people with disabilities or any age with the end stage renal disease, which is called as ESRD. There are two parts. Medicare Part A generally helps cover inpatient hospital care, nursing facility care, nursing home care, hospice care, and home health care. Medical Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. There are some things original Medicare won't cover, including long term care and most vision, dental, and hearing services. Okay, now what is Medicare Advantage? We already know, let's do a revision. Medicare Advantage is an alternative to traditional Medicare offered by private health insurance companies. Medicare Advantage plans cover all the same services under original Medicare Part A and Part B, but often include prescription drugs coverage and extra benefits. Some benefits may provide coverage for routine dental care, that is, dental exams, x rays, teeth cleanings, routine vision care, that includes eye exams, eyeglass, and contacts, routine hearing care, hearing test, and hearing aid, gym memberships, transportation to doctor's visit, over the counter drugs. Now, Medicare Advantage plans can also include prescription drug coverage. To get the same coverage with original Medicare, you would have to buy a separate prescription drug plan and pay a separate premium, guys. Now let's compare original Medicare and Medicare Advantage side by side to help you better understand each one's advantage. All right. Now here, what it covers. Now original Medicare helps cover hospital and doctor visit. All right. Now Medicare Advantage plans bundle Part A and Part B benefit, and some includes prescription drug coverage. Many MA plans also include routine dental, vision, and hearing care benefits not offered by original Medicare. Now, maximum out of pocket cost guarantee. Now, here there is no maximum out of pocket cost guarantee with original Medicare, guys. Now, in MA plans have a yearly limit on out of pocket cost for medical services, after which members pay nothing for covered services for the rest of the plan year. Now, doctors and hospital. When it comes to doctors and hospitals, now if you are enrolled in original Medicare, you can go to any doctor or hospitals in the United States that accepts Medicare. Now, MA plans generally require you to use doctors and facility in the plan's network. If you see an out of network provider, your cost may be higher. Now, monthly premiums. Okay. You usually don't pay a monthly premiums for Medicare Part A hospital coverage if you or your spouse paid Medicare taxes for a certain amount of time while working. You do need to pay a premium for Part B coverage. In 2024, the Medicare Part B premium is $174.70 or higher depending on your income. Now, many Medicare Advantage plans offer an affordable or $0 monthly plan premium as with original Medicare. Medicare Advantage members must continue to pay a monthly Part B premium, which is $174.70 in 2024, along with any MA premiums. All right. Now let's understand deductibles and co-insurance. In 2024, Part A deductible for inpatient hospital coverage is $1,632. The 2024 annual deductible for Part B medical coverage is $240. Deductibles and co-pays vary depending on the Medicare Advantage plans. Now let's understand prescription drug coverage. Original Medicare does not include prescription drug coverage. You may choose to purchase a standalone prescription drug plan from a private company. Most Medicare Advantage plan includes coverage for prescription drugs, although there are also MA plans that cover medical services only. Now, can I change my plan if I don't like? If that's your question, let's get answer to that question. Yes, you can switch from original Medicare to Medicare Advantage or vice versa each year during the Medicare open enrollment period, which runs from October 15th to December 7th, also known as Medicare Advantage and Prescription Drug Plans annual election period or annual enrollment period. This is the primary time when people with Medicare can choose a plan. However, there are other times during the year that may be called open enrollment or special enrollment period when a person can enroll in a plan. All right. Now, let's come to this part. Yes, you can switch from original Medicare to Medicare Advantage or vice versa each year during Medicare open enrollment period, which runs from October 15th to December 7th, also known as Medicare Advantage and Prescription Drug Plan, annual election period or annual enrollment period. This is the primary time when people with Medicare can choose a plan. However, there are other times during the year that may be called open enrollment or special enrollment periods when a person can enroll in a plan. Now, in this case, in both the cases, the answer is same. All right. Now, what should I consider when choosing between original Medicare and a Medicare Advantage plan? Okay. When reviewing your options, here are some important things to remember, guys. Okay. Medicare cost. How much will I pay for premiums, deductibles, co-insurance, and co-payments? Now, doctors and hospitals. Does the Medicare plan have a network? Do the healthcare provider I use accept the plan? Okay, Medicare coverage and benefits. Does the plan include prescription drug coverage or coverage for vision, dental, and hearing care? For health history, how often have I needed care over the past few years? Do I have a chronic condition that require ongoing care? Do I think my healthcare needs will increase or stay about the same? Okay. Now find a Medicare plan that's right for you. You have choices, and that's a good thing. As you continue exploring your options, take some time to compare Medicare Advantage plans and see how to switch your Medicare plans, guys. All right. So now I'm sure that you have the complete idea about the Medicare Advantage versus original Medicare, and which option should you choose. Now, let's move on to what is Medicare Part D, guys. All right, let's click on this option and let's understand this. Now, what is Medicare Part D prescription drug coverage? Medicare Part D helps cover the cost of prescription drugs. Part D is optional and only provided through private insurance companies approved by the federal government. However, Part D is offered to everyone who qualifies for Medicare. Costs and coverage may vary from plan to plan. Read on to learn more about Medicare Part D prescription drug coverage, how to get it, and what it covers. Now, how to get prescription drug coverage, guys? There are two ways to get Medicare Part D prescription drug coverage. Number one, as a standalone prescription drug plan with Medicare. If you have Medicare Part A and Part B, also called original Medicare, you can add a Part D prescription drug plan to your existing coverage. This is one way. Now, second, as part of a Medicare Advantage plan, Medicare Part C, Medicare Advantage plan include all your Part A and Part B coverage. They may also include prescription drug insurance. Not all Medicare Advantage plan include prescription drug coverage, and you must already have Part A and Part B to qualify for Medicare Advantage. All right. If you want to explore Medicare prescription drug plans from Humana. Now, most Humana Medicare Part D plans come with added service at no extra cost to help you maintain your health and your budget. Compare available plans in your areas today. You have to type the zip code and click on Shop Part D plans, and you get the details. Now, what does Medicare Part D cover? Each Medicare Part D plan uses a list of approved drugs to decide what's covered and what isn't. This list is called a drug formulary. All right. The formulary may differ from plan to plan. Many plans arrange their list of covered drugs in different levels called tiers. Generally, drugs in a lower tier will cost less than drugs in the higher tier. Here is one example of a typical Medicare drug plans tier system, but remember your plan may be different. The one preferred generic or brand drugs that are available at the lowest cost shared for the plan. Tier 2 generic or brand drugs that the plan offers at the higher cost to you. And then tier 1 preferred generic drugs, tier 3 preferred brand generic or brand drugs that the plan offers at the lower cost to you than tier 4 non-preferred drugs. Tier 4 non-preferred drugs, generic or brand drugs that the plan offers at the higher cost to you than tier 3 preferred brand drugs. Tier 5 specialty tier, some injectables and other high cost drugs. Tier C select care drugs, select generic and brand drugs used to treat certain chronic condition. Now, what drugs are not covered by Part D? Some medications may not be covered by your Medicare Part D plan. Okay, this could depend on your plan formulary, which may limit average of some drugs based on medical necessity, cost, or safety. Now, Medicare Part D restrictions and limitations. Some prescription drug plans may have restriction on certain medication. These can include prior authorization. Your doctor may need approval from your plan before prescribing some medications. This may be because a drug is only approved for certain conditions or to ensure that the drug is medically necessary. Step therapy. For some conditions, your plan require you to try a cheaper drug on your formulary. Okay, if the cheaper medication doesn't work for your conditions or produce bad side effect, you may be able to move up steps to a more expensive drugs. Quantity limits. Sometimes plan may limit the amount of medication prescribed over a period of time. This is done for safety reason or to cut down on cost. What to do if your drug isn't covered? If you have trouble getting the medications that you want covered, you may be able to appeal. You and your doctor can submit a formal request for an exception to a drug coverage rule. For example, you could send a request to get coverage for a drug that's not in your formulary. You could also send a request to waive a step therapy requirement to use lower tier drugs. How much does Medicare Part D cost? Right? Your cost for Medicare Part D consists of several different payments. The exact amount of this cost may vary depending on your plans, what tier a drug is in, or what pharmacy you use. Monthly premium for most prescription drug plan, you will pay a premium or a monthly fee. This premium is paid in addition to the one you pay for Medicare Part B. Monthly adjustment. If your income is above a certain limit, you may pay a monthly adjustment payment in addition to your prescription drug premium. See this chart on the Medicare website for an explanation of Part D monthly cost by income. Yearly deductible. For many plans, you may have to pay a certain amount each year for your prescription drug before the Medicare drug plan kicks in to cover cost. This amount is called the yearly deductible. For 2024, no Medicare drug plan may have a deductible higher than $545. Now, co-payments or co-insurance. After you meet your deductible, your plan may require you to pay for part of the cost of your prescription. This amount is called the co-payment or co-insurance. In 2024, once you and your insurance spend a combined total of $5,030, including any applicable deductible, you will pay no more than 25% of the cost for prescription. This 25% cap will continue until your cut out pocket spending hits $8,000. Understanding the coverage gap. For most Medicare prescription plan, there is a temporary limit on what the plan covers. This is called the coverage gap, also known as donut hole. In 2024, this coverage gap will be triggered once you and your plan spend a combined $5,030 on covered medications. Once you are in the coverage gap, you will pay no more than 25% of the cost for covered Part D drugs in your plan. Now, catastrophic coverage. I understand, guys. See, let's continue this, but this is something which we have already discussed. As I said before, this is a kind of revision, right? So one time, two times, when you listen to it, you will get it fixed in your mind. Now, let's continue. Catastrophic coverage. Starting January 1st, 2024, once your out of pocket spending reaches $8,000, including certain payments made by other people or entities, including Medicare Extra Help Program, on your behalf, you will move to the catastrophic coverage stage. This means you won't have to pay a co-payment or co-insurance for covered Part D drugs for the rest of the calendar year. How to get extra help? Depending on your income, you may qualify for extra help, guys. Extra help is a program that assists those with limited resources in paying for their Medicare prescription drug cost. Now, you may automatically qualify for extra help if you have Medicare and are enrolled in any of the following programs: full Medicaid coverage, assistance from your state Medicaid program for covering Part B premiums, supplemental security income benefits, right? Even if you don't automatically qualify, you can apply for extra help anytime. Now, how to enroll in Medicare Part D? Typically, if you qualify for Medicare, you qualify for Part D prescription drug coverage. But it's important to keep in mind that you may enroll in Part D coverage only in a few specific periods. Now, your Medicare initial enrollment period (IEP), you can enroll in a Part D plan in the 3 months you turn 65. Okay, the month of your 65th birthday or 3 months after. The Medicare Annual Enrollment Period AEP, this runs from October 15 to December 7 every year. During the AEP, you may make changes to your Medicare Part C and Part D coverage. They will take effect on January 1st of the following year. Now, the Medicare Advantage Open Enrollment Period (OEP), this lasts from January 1st to March 31st each year. You may add, drop, or change your Part D coverage during this time. Special Enrollment Period (SEP), you may be able to enroll in a new Part D plan. Okay, if you are eligible for an SEP, you may qualify for an SEP under certain circumstances, such as if you make changes to a job-based drug coverage plan, or if you have or lose extra help. Now, these are the frequently asked questions. So, what is the Part D late enrollment penalty? The Part D late enrollment penalty is an amount that's permanently added to your Part D premium if for 63 days in a row you don't have Medicare drugs coverage or other credible drug coverage. Creditable I'm so sorry, creditable drug coverage. Now, creditable drug coverage refer to a drug plan that pays at least as much as Medicare Part D and on average. To avoid paying the late enrollment penalty, it's important to enroll in Medicare Part D or have other creditable drug coverage during your IEP. Make sure to enroll in Part D if you lose your creditable drug coverage. If you keep your creditable drug coverage, it's a good idea to keep record proving that you are enrolled. How does Medicare Part D work with other insurance? Okay, if you already have prescription drug coverage through another plan, there will usually be some coordination of benefits between Medicare and your current drug coverage provider. Depending on your current coverage, Medicare will be either your primary or secondary payer for prescription drug coverage, guys. See Medicare explanation on how Part D interacts with other plans to see coverage options that may apply to you guys. How to find the right Medicare Part D plan? There are many Medicare Part D plans to choose from, so it is important to find the one that works best for you. Be sure to check the plan formulary or list of approved drugs as well as the pharmacy network. Medicare.gov has a simple tool to compare Part D plans. Many Medicare Advantage plans include Part D prescription drug coverage. Check out Humana Medicare Advantage plans to see if you may be eligible to enroll and find coverage that meets your needs, guys. Well, I'm sure that now we have the complete understanding of this page. What is Medicare Part D prescription drug coverage, right? Now, let's go to what is Medicare supplement. All right, let's click here. All right, so we are on this page now. What is Medicare supplement insurance? A Medicare supplement insurance plan, also known as Medigap, guys, is healthcare insurance you can buy that may help pay for the out-of-pocket cost original Medicare doesn't cover. Okay, let's explore how Medicare supplement plan work, what they cover, and more. Okay, how do Medicare supplement insurance plans work? Original Medicare Part A hospital insurance and Part B medical insurance pay for many, but not all, healthcare services and supplies. Medicare supplement insurance plan help pay your share of some of the healthcare costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Other important things to know: Medicare supplement insurance plans are not the same as Medicare Advantage plan. A Medigap policy only covers one person. If you and your spouse both want Medigap coverage, you must buy separate policies. Medigap policies do not include prescription drug coverage. If you want prescription drug coverage, you can join a Medicare prescription drug plan Part D. You pay a monthly premium when you have a Medicare supplement plan in addition to the Part B premium from original Medicare. A Medicare supplement policy is guaranteed renewable even if you have health problems. This means you this means your private insurance company can't cancel your policy if you pay the premium and provide accurate information on your application. Medigap policies generally don't cover long-term care, vision and dental care, hearing aids, eyeglasses, or private duty nursing. Now, what does Medicare supplement insurance cover? All right, Medicare supplement insurance plan help pay for cost not covered by original Medicare. Each plan provides a range of benefits so you can choose the best Medicare plan for your needs. Basic benefits. Part A co-insurance and hospital costs up to an additional 365 extra days after Medicare benefits are used. Part B co-insurance or co-payment, blood first treatments. Part A hospice care co-insurance or co-payment. Additional benefit that may be included in certain plans, okay, are skilled nursing facility care co-insurance, Part A deductible, Part B deductible, Part B excess charge, foreign travel exchange up to plan limits, out of pocket limit. All right. Now, everyone has unique healthcare needs. If you are thinking about adding extra insurance to original Medicare, check out how to pick the best Medicare supplement insurance plan for you. All right. What does Medicare supplement insurance not cover? Medicare supplement plans generally don't cover long-term care like non-skilled care you get in a nursing home, vision or dental service, hearing aids, eyeglasses, private duty nursing, prescription drug coverage. If you are looking for prescription drug coverage, Medicare Part D could be the answer. There are two ways to get Medicare Part D prescription drug coverage: a standalone plan, which works with Part A and B, or a Medicare Advantage prescription drug plan, which is called as MAPD. To get coverage for other products and services, a Medicare Part C, a medical advantage plan may be a good option, like Medicare supplement plans. Most Medicare Advantage plans offer various benefits, so you can shop your options and pick the right plan for your needs. Now, who is eligible for a Medicare supplement plan? To buy a Medicare supplement plan, you must be 65 years old or older, enrolled in Medicare Parts A and B, live the state where the policy you want is offered. In some states, you can be under age 65 with a disability or end stage renal disease, which is called as ESRD. Now, when can I enroll in a Medicare supplement plan, guys? Now, you can apply for a Medicare supplement plan policy anytime. However, the best time to buy a plan is during your 6-month Medicare supplement open enrollment period. The Medicare supplement open enrollment period starts the first month you are both age 65 or older and have Part B. The big advantage is you can buy any Medicare supplement plan sold in your state without answering health questions. Even if you have health problem, insurance companies cannot deny you a Medicare supplement policy and must offer the same price as people with good health. If you apply after your open enrollment period, there is no guarantee that an insurance company will sell you a policy unless you are eligible for a guaranteed issue right. If you are under the age 65 and have Medicare, you may not be able to buy a Medicare supplement policy or the one you want until you turn 65. How much does Medicare supplement insurance cost? Each insurance company can set their own price or premium for its Medicare supplement plans. There can be differences in premium that different insurance companies charge for exactly the same coverage. As you shop for a Medigap policy, be sure to compare the same policy between several insurers. For example, if you are interested in Medigap Plan C, compare the price of Medigap Plan C from 2 to 3 different insurance company. This way, you know you will be getting the best price for the plan you want. What are the different types of Medicare supplement plans? There are 10 standardized Medicare supplement plans and what they cover after original Medicare pays its share. The plan covers 100% of this benefit. The plan doesn't cover that benefit. Okay. Now there are certain symbols which are given. Let me go through it. All right. So there are certain symbols which are given in the detailed explanation. You can visit this website and you can go through these details, guys. Here is the detailed understanding in this chart. All right. Okay. Why choose Medigap? Let's understand this now. If you have one or more chronic medical conditions, a Medicare supplement plan can help keep your cost manageable. Coverage is nationwide, so you are covered anywhere that original Medicare is accepted. Medicare supplement plans are also guaranteed renewable, meaning your Medicare policy cannot be cancelled if you pay your premium. Now, everyone has unique healthcare needs. If you are thinking about adding extra insurance to original Medicare, check out how to pick the best Medicare supplement insurance plan uh, for you. Okay.
So thank you for tuning into part 2 of our Humana Insurance video tutorial. I hope that you found this information useful and feel more confident in navigating your Humana Insurance coverage, guys. If you enjoyed this video, then do give it a thumbs up and subscribe my channel for more useful tutorials. Don't forget to hit that bell icon to get notified when part 3 is released. If you have any questions or need further clarification, then comment below. So thanks for watching and see you in my next video. Bye bye.